What's going on, young people? This is our third homework video. We're covering two different types of disorders today. Something called somatoform disorder that you probably haven't heard of before, and then schizophrenia, which is one of the most well-known and most talked about psychological disorders, okay? So make sure that you're getting this done. We're already about halfway through the unit, which is kind of crazy. So we have 5 slides of notes, 5 sections, one about somatoform disorder, and then we're going to talk a lot about schizophrenia because they love to ask about it on the AP exam. It will definitely be on the test. So we'll talk about what it looks like in the DSM-5, what the symptoms are, what causes it, and then what we can do for folks who have schizophrenia. So the first thing, though, before we dive into schizophrenia, I want to talk about somatic symptom disorder. It's just one chapter, one section in the DSM-5, and the root of somatoform is S-O-M-A, soma, which we've said all year. Soma refers to the body, right? So within your nervous system, you have your autonomic stuff and you have the somatic nervous system, meaning the skeletal system, the things that you do control in your body, right? So somatic symptom disorder means there is a body symptom. There is something physical. It could be a rash, a bruise, a pain that is not explainable, right? It's distressing. And it's not because you broke your arm or allergic to something. It seems like it's a psychological thing. So something in your mind is causing this physical symptom. To be diagnosed, according to the DSM-5, you have to have had this symptom for at least 6 months. This is a long time, right? If you're experiencing this like phantom pain, or if you have a rash for 5.5 months, you can't get diagnosed in the DSM-5. It has to be for at least 6 months. And they have to have tried coming up with a physical explanation, right? But your medical tests are normal. They don't explain your symptoms. Sometimes it's called conversion disorder. So for some folks, when they are stressed, so when they are anxious, hyper aroused, they develop some sort of physical symptom that just doesn't make sense. So it's like the mental stress is converting into a physical problem or physical pain, all right? We call also within this category somatic symptom disorder. Sometimes people, if you've ever heard somebody referred to as a hypochondriac, right? So hypochondriasis used to be in the DSM-4. They now have this disorder called illness anxiety disorder, which is related, okay? So these disorders are when there's a physical problem, like you are having the anxiety, the rash, the bruise, the bumps, the pain, and they just can't explain through like a medical reason why you have that thing. Okay, so it's not necessarily like hypochondriasis, being a hypochondriac, that kind of gets exaggerated. So here's a little excerpt. You don't need to write this down, but just for reference, somatic symptom disorder involves a person having a significant focus on physical symptoms such as pain, weakness, or shortness of breath that result in major distress and or problem functioning. The individual has excessive thoughts, feelings, and behaviors relating to the physical symptoms. The physical symptoms may or may not be associated with a diagnosed medical condition, but the person is experiencing symptoms and they believe they are sick. So they're not faking the illness. That's something that people often think, right? When we think about a hypochondriac, right? We think about people who are dramatic or who are, over the top with like, oh, I'm pretty sure I have a brain tumor, right? Or this guy says, I've looked up my symptom on the internet. I think I've got all of these illnesses, right? There's just kind of like, jokes people make about hypochondriacs. In reality, with somatic symptom disorder, there's real physical symptoms that are being experienced. They're not faking it, but something in their mind is causing physical symptoms, all right? So that's somatoform or somatic symptom disorder. We're now gonna spend the remainder of this video talking about schizophrenia. Just one chapter in the DSM-5, but again, schizophrenia, meaning having a split mind. This is not the same thing as multiple personality disorder, right? This is not the same thing as dissociative identity disorder, DID, when people have multiple split personalities. Schizophrenia is different, okay? Not super widespread, especially when compared to the mood or anxiety or substance use disorder, but still widespread enough that we need to talk about it. So I'd mentioned when we talked about the DSM last week, there are 5 DSM categories back in the day of schizophrenia. Now there's just one. You're either on the spectrum or you are not. So how do you get diagnosed? You have to have at least 2 of the 5 symptoms of schizophrenia. And at least one of those symptoms must be what's called a positive symptom. Not positive, like it's a good thing you have that symptom. It's a good thing you're having these hallucinations and delusions. No, no, no. Positive here means that something is being added to your situation. Your mind is doing something that other people's minds don't do. We'll talk about the symptoms on the next slide, so you don't need to write these down here. There will be a chance to write them down next. But be aware, to be diagnosed, at least 2 symptoms, one of which has to be positive. And now, again, you have to have had the symptoms for over a 6-month period with at least 1 month where the symptoms were active, meaning regular, constantly popping up, okay? This is not like, once for 10 seconds you had what you thought was a hallucination or a delusion or your speech patterns were messed up, but repeatedly for an entire month, and it's been going on for at least 6 months to be diagnosed. So what exactly are these symptoms? Next Roman numeral, let's talk about them, all right? So the most common symptom we associate, I guess really the most common 2, I'll put it both up here, are delusions and hallucinations, okay? These are both where you are thinking things that are not real. Here's the difference. Hallucinations have to do with your senses. You are hearing or seeing things that do not exist. Mr. Jones, could you have hallucinations with your other senses? I guess so. I don't think that like a smell hallucination is very common, but touch, sometimes people feel that things are crawling on them or that someone is touching them when there's really no touch present. So the most common ones that you'll read about and have on the AP exam or on the test are about seeing and hearing. So hallucinations, you sense things that no one else senses, that do not appear to actually be present. Oftentimes these are either voices or seeing people or seeing colors and images. Okay. Delusions are not about your senses. Delusions are about your thinking, your thoughts, your beliefs, your worldview, how you interpret the world around you. So 2 of the most common forms of delusions, we call them delusions of grandeur, to be grand. You think that you are special and unique. So people with schizophrenia, they might think that they are secretly royalty or a government worker or a spy, or they're a celebrity. Or sometimes people with schizophrenia will believe that they are like married to a celebrity or they're in a relationship with a celebrity, right? Those are delusions of grandeur. You believe you are more important than you really are. The other common delusion is called delusions of persecutions, meaning you believe that people are out to get you. Could be the government, could be aliens, could be people in your family, could be friends, could be strangers. But folks with schizophrenia will sometimes have delusions where they think that there are people after them, right? A word that we sometimes associate with schizophrenia is paranoia, okay? And we'll talk more about this also. There's also a personality disorder where people have beliefs that people are out to get them, all right? So why do I have a plus in parentheses? Well, these are both positive symptoms of schizophrenia. Again, not positive meaning good, but positive meaning something added to your life, okay? The third positive symptom, people who have schizophrenia, sometimes the way that they talk, it doesn't make sense. It's all jumbled up. Sometimes this is called disorganized speech. Sometimes on an AP exam, I refer to it as word salad. It's like they're just like going back and forth between topics, and they seem to not realize they're doing this, okay? There's a very large percentage of homeless folks who have schizophrenia, right? Because if you are not understanding the world properly, if you're seeing and hearing things that are not there, that can impact your ability to have a job, make your regular mortgage payments on your house or apartment, right? To have those relationships and roommates. A lot of folks who are homeless have a mental disorder. So I've had experiences when I've done some homeless ministry work, and I've talked to folks who very clearly have schizophrenia, and they feel like they're making sense, but I just can't understand their flow, can't understand what they're talking about. That's another positive symptom of schizophrenia. 2 more symptoms. So we've had a thinking symptom, a sensing symptom, a talking symptom. This is a body symptom. It's when sometimes like the body arms might move in strange directions. There's something called a waxy flexibility. I've always seen like a wax figure in a wax museum, right? They just like might look like they're like stuck in a particular position. Sometimes people with schizophrenia, it's like their body gets stuck and they might not realize it. They don't have control over their body parts, over their limbs. Okay. The last thing here is a broad category of negative symptoms. So the positive symptoms, 1, 2, 3 up here, were you doing things that other people don't do, right? It's like being added to your life, your situation. The negative symptoms are when people with schizophrenia, they're not doing things that most other people do. They maybe don't show the emotion that other folks show. They don't have the energy. They don't talk. They don't interact with people normally, right? They seem to just not do things. They don't have the energy or motivation for it, okay? These are the schizophrenia symptoms. Remember, to be diagnosed, you gotta have at least 2 of them for 6 months, active for 1 month, and of the 2, at least 1 has to be a positive symptom. So you could be diagnosed because you have delusions and hallucinations, or because you have hallucinations and disorganized behavior, or because you have disorganized speech and some negative symptoms. You could not be diagnosed with schizophrenia just because you have multiples of 4 and 5 here. You gotta have at least 1 of 1, 2, or 3. So what causes this? Well, we've actually mentioned throughout the course of the year, Unit 2 in particular, we talked about some of the causes. So it is genetic. If a parent has it, you have a higher likelihood of developing it, okay? Too much dopamine can cause and be associated with schizophrenia, okay? So medications, we'll talk about this next section, but medications target dopamine. They want to lower your dopamine. A third thing that's interesting is there's been some recent research that shows that moms who develop a virus while pregnant, they are more likely, those kids have a higher vulnerability to schizophrenia, okay? So that's really interesting with COVID world, because what is it now? Something like 1 in 6 or 1 in 7 Americans have been exposed to COVID or something like that. I think that was the number actually maybe for teachers in Georgia. 1 in 6 have had COVID at this point. But like folks who are pregnant and have been pregnant during COVID, if they've been infected by a virus, like that could impact baby's development. So we won't find out for 25 years, right? Symptoms of schizophrenia don't normally show up until like late teenage or like early 20s is most common. Mid-20s, 30, right? That 20 to 30 range usually. We won't know for 35 years if the widespread coronavirus, if that's going to have an impact on all these babies that have been born in the last few months and they're going to be born in these next few months. Like, it could impact them. It's really interesting, the long-term impacts that this teratogen could have on baby's development. So what do we do for folks with schizophrenia? There's not a cure, y'all. It's like right now, if you get diagnosed with schizophrenia, you will probably be in some sort of treatment or therapy program for the rest of your life to help manage those symptoms, okay? So probably the most common treatment is prescribing what are called antipsychotics. Schizophrenia is a psychotic disorder. Psychosis is when your mind, the way you think about the world, is affected. So antipsychotics, these drugs that target dopamine, they're meant to help you have a more normal understanding and experience of the world. Problems with these drugs is that they're good for your mind. They can really impact your body negatively, okay? So make sure that you write down, maybe circle this term, tardive dyskinesia, okay? Let's look at the roots here. So kin always have to do with movement, right? Your kinesthetic sense is your body's movement. Dys is a bad thing, D-Y-S. It's like you're not moving well. And T-A-R-D, tard, that root means slow. My musical people, right? If you see the musical sign, retardando, it means to slow down the music, right? So it's like your body can no longer move. Your body has slow movements. So you have to kind of make a decision. Are you okay with your body being limited in order to have your mind more clear and in better touch with reality? So it's meant to bring you back. So these are like the most common medicines, the specific types of antipsychotics. We might watch a video in class, okay, where we see a young girl actually who was diagnosed with schizophrenia who took Thorazine. So you may have heard that before. We'll talk a little about Janie and her situation. So other things that we can do besides drugs, there's something called family therapy, which is where a counselor, therapist, psychologist, instead of just meeting with the patient, they will also meet with the patient's siblings, spouse, romantic partner, parents, kids even, to make sure they all understand the full problems with schizophrenia and what might be going on in their family member's brain and why their family member might act unusually or erratically. So family therapy is this idea that we don't just support the patient, but we want to support people who are around them, maybe even coworkers or friends who might also want to join for some of these therapy sessions so they can fully understand what the person with schizophrenia is dealing with. In severe cases, when drugs aren't working, they might use some sort of ECT, electroconvulsive therapy. Okay, like back in the day, they just call it shock therapy. Really rough. And y'all can go watch some things on YouTube about like old school shock therapy for folks with psychological disorders. This is now like a last resort, and it is better. They have better, more focused, specific electroconvulsive therapy versus like the general shock therapy. Seizures, they basically put people into seizures and just kind of hope that their brain got rewired. Okay, they're a little more targeted now, but this is still kind of a last resort if drugs are not working. All right. If you have more questions, there's a lot of videos you can watch about schizophrenia. There's a great crash course that talks about schizophrenia and the difference between schizophrenia, the split mind disorder, versus the multiple personality, the DID, and those dissociative disorders that we talked about in the last video. So it might be worth watching to make sure that you don't get those mixed up and confused. Without your notes, it'd be nice if you could try to answer these 6 questions, see what you can do from memory, because remember, the AP exam, you're not going to have your notes. So you got to have that information up in your brain. Okay. I'll see y'all in class. Peace out.